Hi, everyone. I'm Dr. Jordana Hirschthal, and I'm a board-certified dermatologist in Boca Raton, Florida. And today I'm going to review how I treat lentigines with the Discovery Pico. So let's get started. So I live in Florida, and I have a lot of patients who have diffuse sun damage. So this device has been really helpful in my practice to help clear the skin, help clear the brown spots, especially resistant brown spots that you may not always be able to target with another device like IPL. So when I'm using the Discovery Pico, I'm using the 532 wavelength for lentigines. And in this case that I'm showing, it is a gentleman who has a landscaping business. So you'll see he has extensive sun damage and he just wanted his skin to look clearer. And I felt that the Pico would be a great option because of the speed that it offers during the treatment. It's relatively comfortable and it's very effective at removing pigment. So this gentleman is a skin type 1-2. He's around 60 years old. The general approach that I take to using the Pico laser to remove lentigines is I do a first pass typically with the 532 on the picosecond setting at 0.7 to 0.8 joules with the 5mm spot size. And I will either directly target the lentigines if they're not entirely diffuse, or if it's diffuse, as in the gentleman you'll see, I may just do one pass with the 5mm and paint the whole face. Another setting that I sometimes use when there's a little less, when it's not as diffuse lentigines, they're more focused, but I just want to make sure I pick up a lot of that background pigment. I'll start with the 8mm fractional handpiece. And again, on the 532 picosecond setting at 0.4 joules, and I'll typically do 2 to 3 passes, cross-hatching the passes to make sure I get good coverage. And then I will go back with the 5mm spot size and directly target individual lesions. I also find that the 5mm handpiece is really good to get those flat seborrheic keratoses that are sometimes really difficult to remove with other modalities. So just to recap that, I'll either sometimes paint the whole face with the 5mm handpiece if it's diffuse lentigines, or if it's more focused lentigines, I'll go in and treat those with the 5mm handpiece and also do a fractional pass for any background pigmentation. Here's an example of what this gentleman that I treated looks like. This is just after one treatment. So he got significant clearing. This is his forehead. And I treated his entire face, his neck, and his arms as well. I'll say that in order to prepare patients for treatment, I usually use elastin nectar for about a week before the treatment because it helps clear out some of that dead collagen and elastin and really helps the skin recover from laser procedures. So I'll usually have them prep with elastin nectar. If that's not an option or they don't have that and they want treatment that day, then we just go ahead and treat. I clean the skin with alcohol and then wait till it dries and then start the treatment. In order to control for pain, patients can either use topical numbing. I use BLT compounded. I also have Pronox in my practice, which is half-dose laughing gas, and that helps tremendously take the edge off for patients. And it's out of their system in 5 minutes. So it's a really nice tool to have to help treat or to help control pain. I would say everybody experiences pain differently. Most people are pretty comfortable with this treatment, and especially if you use topical numbing or Pronox, they do pretty well with the pain. My clinical endpoints for this treatment are darkening of the skin lesion. So you should see the lesions turn 2 to 3 shades darker. It might take a few seconds, so I don't aggressively do a second pass until I give the skin a little bit of time to see if the darkening is developing. In general, I would say patients need anywhere from 3 to 6 treatments to really get clear. Everybody's different. A lot of times you'll see, as in this patient, great improvement after one session, but to remove the rest of the pigment there, I did require another 2 to 3 sessions. I always tell patients, you know, the laser sees the darkest lesions first. That's why you need multiple sessions. And with each session, you can turn up the jewels if you need to, if you're finding you're not reaching those clinical endpoints. My technique is, like I said earlier in the slide, if it's just a few isolated lesions, I'll just use a 5mm spot size or a 3mm even to target individual lesions. If it's more diffuse, like as in this patient, I just took the 5mm and painted the whole area with one pass. And if I want to give a full face treatment, but there's only some isolated lesions, but some of that background is chromia, I'll do a fractional 532 followed by treatment with the 5mm handpiece for the individual lesions. Post-treatment, I always put elastin nectar on my patients and advise patients to wear sunscreen, avoid the sun for at least a week. It typically takes the lesions about 7 to 10 days to fall off. They slowly fall off every time a patient washes their face, so they can expect to see results within 7 to 10 days. And that's the critical time to avoid sun so you don't have any complications from the laser. Here's an example of how fast the treatment goes. That's one of the things I love most about the Discovery Pico. You can really push the hertz. It goes up to 10. So let's see. This obviously is not at 10 hertz. This was one of the first times I actually used the laser. So you can see the frosting and the darkening of the pigment. So when I was first playing with the laser, I was doing individual lesions, but I eventually ended up painting the whole area, and it came out really nicely, as you saw in the after pictures. So my thoughts on the Discovery Pico for lentigines. Minimal downtime in the sense that patients can resume their normal activities. They don't need to hide. They will have darkening of the lesion, but they can, again, cover it up or you know, do or not go out. But I don't think it doesn't really inhibit you from doing your daily activities. It's highly effective. It's very targeted. It's very good to remove that resistant pigment or resistant lesions you may not be able to get with your IPLs or other wavelengths. And the other thing I like about this is that you can combine it with other modalities. I typically will use the 1064 wavelength on the same device to do some collagen stimulation for wrinkle reduction, and I do it the same day. I usually go deeper to more superficial, so I'll do a 1064 first, and then I will go in and target the brown spots. So that's a nice combination treatment for patients to receive. You can also do a fractional CO2 or an erbium. There's a handpiece, an erbium handpiece you can also attach to this laser. So you can go over your 532 with erbium afterwards to get a really nice result. My post-treatment, again, is elastin nectar and sunscreen. I usually recommend patients use nectar for at least 3 to 4 days after the treatment, and then they can resume just their normal skincare, although I do advise always to avoid retinol after laser treatment for at least a week. And what I love about this laser is that you have multiple treatment indications. So you can treat wrinkles, you can treat acne scars, you can treat lentigines, you can treat melasma, and you can also do tattoo removal. So it's a big workhorse in my practice. You have the ability to add IPL and erbium to the device, which is also really nice. You can build out a really customized system. It's fast, it's comfortable, and it really does a great job at treating those lesions. Thank you.